Next card. You can't breathe. Your neighbor grabs his chest and falls to the ground. Or you just witnessed a car wreck. What would you do? Hi, my name is Adrian Maurice. As an EMT intermediate, I arrive on scene to many of these situations often. If this hasn't happened to you before, it very well could. That is why I would like to take a minute of your time to discuss the emergency medical system, or EMS. Today we will talk about what number to dial in case of an emergency, the personnel expected to arrive on scene or at your situation to help you, and the civil roles or things that you can do to help prepare for the situation and possibly save lives. First of all, we will discuss what an emergency is. Oxford Dictionary describes an emergency as a serious happening or situation needing prompt action. So you dial 911. Not always for an emergency that you would expect. Sometimes if you dial 911, your local area might not provide EMS or emergency medical services. They might only have police, or in some areas they might only have fire. If you look in the yellow pages, Houston, Southeast Pasadena, the yellow pages will have a number at the very first page for you to dial in case of an emergency, 911, and the services provided in your area. Here we see fire, police, and medical. Now, with this in mind, a dispatcher will answer the phone once you have dialed the emergency number. And they will ask you questions such as, what location are you at? What is the nature of the call, or what's happening? Why did you dial 911? How many people are injured or in need of assistance? These sort of things are very typical questions that a dispatcher might ask someone who has dialed 911. With this in mind, what personnel would you expect to arrive? In the medical field, there are different levels of care. From the very basic, which is an EMT or emergency medical technician basic, to an EMT intermediate and an EMTP or paramedic. The paramedic, of course, being the highest level, will conduct cardiac monitoring and administer medications to help injured persons, pain management, and other things such as these. An EMT intermediate will provide IV access and fluids and some limited medications. And an EMT basic primarily controls bleeding, cervical spine, immobilization, and oxygen therapy. Now, if you witness a car accident, you might not just need an ambulance. If the emergency medical technician cannot access the patient, then a fire engine or ladder truck might have to be called to extricate or remove the patient from the vehicle or from a building in order for the EMS to access them. Now, while this is going on, crowd control and traffic is usually directed by police. So in this situation, might require all three types of personnel or all three types of services at the same time. Civil roles and responsibilities are things that you can do as an individual to prepare for first aid situations, cardiac arrest situations, or cases in which someone standing next to you might be choking. These classes are recommended by AHA or American Heart Association to provide civilians with basic knowledge of how to improve their situations and improve patients' outcomes by starting the care earlier than when EMS can arrive. Now, American Heart Association not only recommends a CPR class, but also what is called AED training, which is an auto external defibrillator training and is used for cardiac arrest patients. Now, what this does is it sends electricity to the heart and restarts it. It sounds scary, but it's actually very simple with proper training, and anyone, even children, are capable of performing these procedures. Also, preventative care is important, and it is our job as EMS and as medical providers to inform the public of things they can do to prevent injury, to prevent disease, and things of these nature include proper diet, exercise, and proper administration of medication. With this in mind, I hope that you are better equipped and prepared for an emergency situation that might arise, and I hope that you never have to witness or be a part of this, but it is in our human nature to be imperfect, and things do happen, and that is why you will now know what number to dial, what personnel to expect, and things that you can do to prevent these situations from occurring or to get care to your patients sooner. Thank you very much, and I would like to end with a quote by Winston Churchill: "If you fail to plan, then you plan to fail." Thank you.